Nurse Aide Test Prep Guide. Question 1. Which of the following can cause an inaccurate pulse oximetry reading? Option A, nail polish. Option B, client holding their breath. Option C, client sleeping. Option D, client sitting up. The correct answer is option A, nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, they don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 2. A client with dementia has a tendency to wander. The nurse aide should: Option A, place the client in a locked room. Option B, provide a safe wandering area. Option C, use restraints. Option D, ignore the behavior. The correct answer is option B, provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 3. A client is having a seizure. The nurse aide should: Option A, put a spoon in the client's mouth. Option B, hold the client down to stop the seizure. Option C, clear the area and turn the client to their side. Option D, leave the client alone. The correct answer is option C, clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 4. When a client with dementia is sundowning, becoming agitated at dusk, the nurse aide should: Option A, keep the environment bright and noisy. Option B, use a calm, gentle approach and low lighting. Option C, give the client a sleeping pill. Option D, ignore the agitation until it passes. The correct answer is option B, use a calm, gentle approach and low lighting. Sundowning is managed with a calm environment, low lighting, quiet, and a gentle approach reduce agitation. Bright, noisy environments are overstimulating. Sleeping pills require an order and should not be the first response. Question 5. When making an occupied bed, the nurse aide should: Option A, roll the client side to side, working with one side at a time. Option B, have the client sit in a chair. Option C, make the bed with the client on one side only. Option D, ask the nurse to help. The correct answer is option A, roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 6. The RACE acronym stands for: Option A, rescue, alarm, contain, extinguish. Option B, run, alert, call, evacuate. Option C, rescue, assess, control, evacuate. Option D, remove, alert, contain, extinguish. The correct answer is option A, rescue, alarm, contain, extinguish. RACE is the standard fire response protocol. Rescue clients in immediate danger, alarm, pull the fire alarm / notify, contain the fire, close doors, and extinguish, if safe. Question 7. Which position is best for taking a rectal temperature? Option A, Fowler's position. Option B, dorsal recumbent. Option C, Sims position. Option D, supine position. The correct answer is option C, Sims position. Sims position, lying on left side with right knee flexed, provides the best access to the rectum and is most comfortable for the client during a rectal temperature. Fowler's is a semi-sitting position. Dorsal recumbent is used for pelvic exams. Supine is flat on the back. Question 8. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should: Option A, ignore the difference. Option B, recheck it after 1 to 2 minutes. Option C, change the client's medication. Option D, document the first reading only. The correct answer is option B, recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 9. Which activity is most appropriate for a client with dementia? Option A. Complex puzzles. Option B. Simple folding tasks. Option C. Reading medical journals. Option D. Watching educational films. The correct answer is option B. Simple folding tasks. Simple, repetitive tasks like folding towels provide a sense of purpose and are appropriate for clients with dementia. Complex puzzles in medical journals are too challenging. Watching educational films may not be engaging. Question 10. When measuring intake and output, INO, the nurse aide should record. Option A. Only water the client drinks. Option B. All fluids consumed, including ice chips, soup, and gelatin. Option C. Only oral fluids. Option D. Only 4 fluids. The correct answer is option B. All fluids consumed, including ice chips, soup, and gelatin. Intake includes all liquids and foods that become liquid at room temperature, such as ice chips, soup, broth, gelatin, juice, milk, and water. Recording only water or oral fluids misses significant fluid sources. Question 11. When taking an axillary temperature, the nurse aide should leave the thermometer in place for Option A, 3 to 5 minutes. Option B, 5 to 8 minutes. Option C, 8 to 10 minutes. Option D, 10 to 12 minutes. The correct answer is option C, 8 to 10 minutes. Axillary temperatures require 8 to 10 minutes to accurately reflect body temperature because the armpit is a peripheral site. 3 to 5 minutes is insufficient. For electronic thermometers, follow manufacturer instructions. Question 12. Which sign indicates a client may need toileting assistance? Option A, restlessness and picking at the sheets. Option B, closed eyes and slow breathing. Option C, smiling and laughing. Option D, sitting quietly in bed. The correct answer is option A, restlessness and picking at the sheets. Restlessness or agitation often indicates a need to use the bathroom, especially in clients who cannot verbally express this need. Offer toileting regularly. Question 13. When using a fire extinguisher, the nurse aide should remember the acronym. Option A, pass, pull, aim, squeeze, sweep. Option B, race, rescue, alarm, contain, extinguish. Option C, ABCD, airway, breathing, circulation, defibrillation. Option D, pace, pull, aim, contain, extinguish. The correct answer is option A, pass, pull, aim, squeeze, sweep. PASS is the correct acronym for using a fire extinguisher. RACE is for fire response, rescue, alarm, contain, extinguish. PASS is specifically for extinguisher use. Question 14. When providing oral care to an unconscious client, the nurse aide should. Option A, brush the teeth vigorously. Option B, use a sponge-tipped swab moistened with mouthwash. Option C, place the client on their side and swab gently. Option D, skip oral care for unconscious clients. The correct answer is option C, place the client on their side and swab gently. Unconscious clients should be positioned on their side to allow fluids to drain, preventing aspiration. Gentle swabbing with a sponge-tipped applicator should be used. Oral care should never be skipped, it prevents pneumonia and infection. Question 15. A client with depression refuses to get out of bed. The nurse aide should. Option A, allow the client to stay in bed. Option B, gently encourage the client to get up. Option C, force the client to get up. Option D, call the family to get them up. The correct answer is option B, gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 16. When applying a gait belt, the nurse aide should place it. Option A, around the client's chest. Option B, Around the client's waist, over clothing. Option C. Around the client's hips, under clothing. Option D. Around the client's neck. The correct answer is option B. Around the client's waist, over clothing. A gait belt should be snugly around the client's waist, over clothing, not bare skin. Not over the chest, restricts breathing, not under clothing, skin irritation, and never around the neck. Question 17. When documenting client care, the nurse aide should: Option A. Use vague descriptions. Option B. Be objective, accurate, and use only abbreviations that are approved. Option C. Include opinions about the client. Option D. Write in pencil so errors can be erased. The correct answer is option B. Be objective, accurate, and use only abbreviations that are approved. Documentation should be objective, accurate, and use only approved abbreviations. Opinions are not appropriate. Pencil should not be used. Documentation should be in ink. Question 18. After giving a client a back rub, the nurse aide should always note: Option A. The last time the client had a back rub. Option B. Any change in the client's skin. Option C. The client's weight. Option D. The amount of lotion used. The correct answer is option B. Any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 19. When disposing of contaminated linens, the nurse aide should: Option A. Shake them out before placing in the hamper. Option B. Place them in a leak-proof bag without shaking. Option C. Fold them neatly before disposal. Option D. Sort them in the client's room. The correct answer is option B. Place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 20. A client with a history of falls has been repositioned. The nurse aide should also ensure: Option A. The bed is in the highest position. Option B. The room is completely dark. Option C. The bed is in the lowest position and the brakes are locked. Option D. The client's family is called. The correct answer is option C. The bed is in the lowest position and the brakes are locked. The bed should be in the lowest position to reduce fall injury risk, and the brakes must be locked. The room should have adequate lighting. Calling the family is not part of the safety routine. Question 21. A client with dementia has difficulty eating. The nurse aide should: Option A. Feed the client quickly to ensure adequate nutrition. Option B. Allow plenty of time and provide cues to eat. Option C. Puree all food to make it easier. Option D. Skip meals when the client is resistant. The correct answer is option B. Allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example: pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 22. What is the correct way to transfer a client from bed to chair? Option A. Pull the client by their arms. Option B. Use a transfer belt and proper body mechanics. Option C. Lift the client under the armpits. Option D. Have the client stand without assistance. The correct answer is option B. Use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 23. The compression to ventilation ratio for adult CPR, single rescuer, is: Option A. 15:2. Option B. 30:2. Option C. 5:1. Option D. 10:1. The correct answer is option B. 30:2. For adult CPR by a single rescuer, The ratio is 30 compressions to 2 breaths. This is the American Heart Association standard for effective CPR with minimal interruption. Question 24. A client tells the nurse aide that they want to harm themselves. The aide should: Option A, keep the information confidential. Option B, tell the client that they are being silly. Option C, report it to the nurse immediately. Option D, promise the client that everything will be fine. The correct answer is option C. Report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 25. Standard precautions apply to which bodily fluids? Option A, blood and blood products only. Option B, all body fluids, secretions, and excretions. Option C, only visible blood. Option D, only if the client is diagnosed with an infection. The correct answer is option B, all body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious.